Welcome back to Ethnic Health America. I'm your host, Dr. Mike Lenore. We're very fortunate today to have Dr. Alyce Adams. She's a researcher for Kaiser Permanente. I want to talk with her about a variety of issues, primarily focusing on obesity and diabetes. Dr. Adams, thank you for joining us.
Oh, thank you.
Tell us a little bit about your background, what made you decide to go into research, and how you got there.
Sure. Well, I was very motivated by high rates of, first of all, lower leg amputation among African Americans, particularly low-income African Americans in my own family, as well as in the larger community. And so I wanted to understand that better, understand why it was happening, and to see what we could do about it. And I was also interested in the fact that a lot of these people who are experiencing adverse events from diabetes and other chronic conditions actually had health insurance. So I was very curious to know why it was that people, even when they have health insurance, still have these very traumatic and debilitating outcomes when they have chronic conditions. And so that sort of started me on the path to research. I ended up doing a master's degree in public policy, where I learned about legislation and policies that affect health, and then went on to get my PhD in health policy.
Now, just divert a bit before we focus on the obesity diabetes piece. One of the biggest challenges in any health system is the whole concept of why people don't use services that are available to them to prevent illnesses that they ultimately get.
Well, I think, first of all, the problem of adherence isn't specific to any given community.
No,
As we know, the problem of adherence is one that we all struggle with, whether it's lifestyle modifications to address asthma or diabetes or something else. And so I think that's not unique even to what we do within the healthcare system, but us as human beings and how we behave. There are lots of different factors that might go into play. You can imagine factors such as logistical factors, the timing of when the healthcare services are open. There's also issues with respect to how you feel when you walk into a healthcare facility. Previously, I've done a lot of work with Native American tribes, and what you heard sometimes from them and from the people who visited the Indian Health Service facilities was this feeling of not feeling welcome and not feeling that someone would understand their needs. And so that also keeps people from visiting their doctor. In terms of home management of various chronic conditions, I think there are a host of different factors. We probably named, just between the two of us, all the reasons why we don't do all the things that we should do, right? So I think part of what we have to try to do is try to understand what are some barriers that could be removed for people to make it easier for them to do what they perhaps want to do, but either don't have the motivation or the knowledge or the skill base or simply the time and other things that it takes in order to be able to exercise those activities.
Well, thank you for that. I have some theories about that, and I think sometimes you have to put the clinic next door to the room in order to get the services, but I think that is a very good explanation, and thank you. Obesity, obviously, in this country is a major, major problem, maybe not just in this country, but throughout the world. Is there an obesity epidemic?
Well, I think the CDC has sort of declared that there is certainly an obesity epidemic, and like you said, it's not just here in the United States, it's all over the developing world in particular.
When you talk about obesity, I mean, obviously, what we're most concerned about is the whole process as it relates to children. I've always maintained for parents and anybody I could say that a 3-year-old can't drive to McDonald's. I mean, they can't, they got to get there some way. What role does early intervention with good dietary habits play in the ultimate outcome of obesity?
Well, I think that's really become the place where everyone wants to start in terms of the CDC and other organizations about rallying around addressing these needs in kids for a couple of different reasons. We just talked about behavior. Well, behavior set in when you're young. And so you can imagine if we can get to kids early and get them in the habits that we would like to get them into in terms of preventing obesity, eating the right things, exercising, etc., we have a better shot at continuing that activity as they get older. So that's incredibly important. But also it's important to know that obesity in young age also influences your likelihood of developing diabetes and cardiovascular disease, not only now as an older adult, but even as a teenager. Or a young adult. We're now seeing people with diabetes and hypertension and cholesterol management problems that we didn't anticipate could have happened for someone so young. And so those things happen very early on. So for all of those reasons, you want to intervene early as possible.
When we talk about the early intervention, we have a pretty organized and formal process during the first year of life. I mean, it's either breastfeeding or it's bottle feed, but it's organized. After that first year, my experience as a pediatrician tells me it's absolute chaos. I mean, that nobody really has an organized plan to either educate or instruct or provide for children a diet which is deliberately focused on being nutritious. Has that been your experience?
Well, I know some of the research is really starting to focus on what happens to kids when they stop coming to the doctor routinely for those routine shots and everything that the kids get in the early stages of life. And so people are looking at things like what's being served in the cafeteria and how that influences children. And if you intervene to improve those foods, what happens with kids in terms of both losing weight as well as maintaining good weight. And so there's a lot of effort now, I think, to examine the community and the places where people live and work and go to school and see how we can improve the availability of healthy food, like in the local grocery store. If you have a local grocery store, those types of things, food availability.
Do you think that we're putting too much emphasis on the food component? Because I do recall from when I grew up that we had a lot more opportunities for exercise. So what we ate was not so much predicated upon whether the grocery store was there or not. What we ate was what was on the table. Now that's changed too. I mean, I couldn't dictate to my parents, then, well, I don't want this, I'll take that. And we didn't have very many fast food places, so that my diet was pretty much what my family's diet was, and that's what tends to happen.
Certainly, and if you think about obesity, what it is, it's sort of this combination, this imbalance, if you will, between the energy that you take in through food and the energy that you expend through exercise and other things. And it's an imbalance in what you take in and what you expend that makes us overweight and leads to obesity. And in a study that we did several years ago, we looked at the developed world and tried to understand, well, is it what you take in or what goes out? And while we didn't come up with any definitive answers across the board, we did find in the United States that if our calculations were correct, about 75% of the obesity rise that we were seeing in the United States over the last 10 years was actually more likely to be due to what we're intaking, and about 25% was about exercise. Now, again, there's a lot of trouble in trying to measure these things. When you measure exercise, it's mostly by self-report and as well as diet. And so what you're getting is people's self-reports, which may or may not be as accurate as we would like in terms of those analyses. But that's generally what we found. And again, it's going to vary depending on the individual community, the individual family, in terms of how much of it is intake versus expenditure. But the idea is if we can get those things in balance, we should be able to get a handle on the obesity epidemic.
All right, our discussion is with Dr. Alyce Adams. When we come back, she and I are going to solve the obesity and diabetes problem in this country. We'll be right back after this break.